Hello everyone, welcome to Alacrity Explains Anatomy. Today we are going to be looking at the osteology of the radius. Please don't forget to subscribe so that you see whenever we drop other videos. So let's get to the video. We're looking at the osteology of the radius, and the radius is lateral bone of the forearm in anatomical position. When one is standing in anatomical position, the radius is a lateral bone of the forearm, participates in elbow and wrist joint, helps in the formation of these two joints. So if you look at the radius, like we said, if you look at the forearm and you zoom out on the forearm, you see that this bone, which is the lateral bone of the forearm, is what we are regarding to as the radius. He said it helps in the formation of the elbow and wrist joint. The elbow joint, it is helps in the formation of the elbow joint, the head, and the wrist joint at the distal part. So it rotates around the ulna during pronation and supination. Pronation and supination are movement of the forearm. So during this movement, the ulna rotates around the what? The radius, sorry, rotate around the ulna. Now, the radius is divided into three parts. We have proximal, shaft, and distal end. These are proximal part. This is our distal part, and this is our shaft. Divided into three parts. We are going to look at those three parts, starting with the proximal end of the radius. The proximal end of the radius has a head which is disc shaped and articulates with the capitulum of the humerus. Remember, the radius forms a joint superiorly, proximally with the humerus as well as with the ulnar bone. So at the head, we have the proximal end of the radius. We have a head which helps to articulate with the capitulum of the humerus. So this is the head of the radius. You see that it is shaped like a disc, right? Yes, has a disc shape. It articulates with the humerus. We have an articular circumference that articulates with the radial notch of the ulna. You see something like that around here that articulates with the radial notch of the ulnar bone, because we said that the radius at the proximal part forms two joints. It has a joint with the humerus and has a joint with the ulna. Then it has a neck, which is a constricted region below the head. You can see that this image is a constricted region below the head of the radius. It has a radial tuberosity, which is the site of insertion for the biceps brachii muscle. The biceps brachii muscle inserts at the radial tuberosity here. Good. Now let's look at the shaft of the radius. It is triangular in cross section. If you take a cross section of the radius, you see that the radius is triangular in shape. It has three borders, which are anterior, posterior, and the interosseous border. The interosseous border is the site for attachment of the what? The interosseous membrane. Then it has three surfaces: an anterior surface, a posterior surface, as well as a lateral surface. The interosseous border, like we said, it gives attachment to the what? The interosseous membrane. Very, very important. Now let's look at the distal end of the radius. The distal end of the radius is expanded. If you compare it to the proximal end, it is a more expanded end. You see how large it's looking compared to the proximal end. It articulates with the scaphoid and the lunate bones. The scaphoid and the lunate bones are carpal bones. So among the carpal bones, the distal end of the radius articulates with only the scaphoid as well as the lunate. Several textbooks use different. Some will tell you it articulates with the scaphoid, the lunate, and the trachea. But in this video, we're seeing articulate with the scaphoid and the lunate bones only of the carpal bones. Now you also have an ulnar notch which articulates with the head of the ulna. Now we have an ulnar notch which articulates with what? The head of the ulnar bone. You know the head of the ulnar bone is located distally, while the head of the radius is located proximally. So we have a styloid process with the lateral projection on the distal end of the radius. This is a styloid process, the structure you have here. Styloid process, which is the distal projection, the lateral projection on the distal end of the radius. We have a dorsal tubercle, which is set for attachment of what? The extensor tendons. This is a dorsal tubercle, is site for attachment of the extensor tendons. Now let's talk about the muscle attachment of the bone. We have the biceps brachii, which attaches to the radial tuberosity. We have the pronator teres muscle, which attaches to the lateral surface of the bone. You look at the bone here, you have the pronator teres, which is attaching to the lateral surface. This is the lateral aspect, lateral surface of the bone. And we have the supinator muscle, which is proximal to the radius. Supinator muscle attaches here, proximal part of the radius. We have attachment of the supinator muscle. Remember that this is an anterior view and this is a posterior view of the radial bone. We have flexor and extensor muscles that attach along the shaft. Now, if you look at this, you're going to see that we have the anteriorly, we have the flexor pollicis longus attaching here, covering the space. We have the pronator quadratus muscle, which is helps in pronation of the forearm. We have the brachioradialis muscle attaching distally. We have the extensor pollicis brevis attaching at the posterior aspect of the shaft of the radius. We have the adductor pollicis longus muscle. And remember, I also mentioned that the biceps brachii muscle attaches to the what? The radial tuberosity. So let's look at the ossifications of the radius. Now they have primary ossification center and secondary ossification centers. The primary ossification center is found at the shaft, which appears in the 8th week of fetal life, while the secondary ossification center is found at this one found at the head as well as the distal end of the radius. Fission of these ossification centers occur at adolescent age. Clinical anatomy, the applied anatomy. Colles fracture. This is the most important applied anatomy of the radius. Colles fracture. The distal fracture of the radius is fracture at the distal end of the radius, somewhere around here. Distal end fracture, and this distal end fracture, you see that the distal fragment of the radius overrides the rest of the bone. This is the distal fragment of the fracture, and this is the proximal fragment of the fracture. After this fracture here, this fracture, we call this fracture the Colles fracture. So there is displacement in this manner. This part of the distal fragment displaces more dorsally, while the proximal fragment displaces more anteriorly, giving a Diener fork deformity. We say that this gives a Diener fork deformity. The Colles fracture gives a Diener fork deformity. We also have radial head fractures, which affect the movement of the elbow, as well as dislocation of the head radius. Now, if you look at this structure here, around the neck of the radius is a structure that attaches there, and this is called the annular ligament. This annular ligament help to hold the head of the radius in place in formation of the elbow joint. So whenever there is a pull on the elbow joint, this can cause dislocation of the head of the radius, where the radius pulls out of the annular ligament, and this causes dislocation. So That will be all for this video. Thanks for watching. Make sure to subscribe to Alacrity Explains Anatomy so that you see every video we drop, and make sure you turn on the notification button so that you don't miss any.